Welcome to the office. David,
Hey.
welcome to the office.
Yeah.
How can I help you?
Well, how can you help me?
Why are you here?
I would say I've pretty much chronic pain in my left hip and knee.
Okay. Started when? When you say chronic?
It initially started actually like 8 years ago, where I remember like the first pain really started in my back on the left side.
Doing what?
Office job, a lot of stress. Was doing triathlon 6 to 9 times a week.
8 years ago started in your mid-back.
Approximately, yeah. Like I remember.
No trauma or injury you remember?
No, it was just a lot of stress during my real estate apprenticeship.
Okay.
And was also doing triathlon a lot, like working 50 hours and training a lot, like just going full steam all the time.
Okay.
And then I remember like in swim training, it started also pain in the left shoulder.
Okay.
And then, just with my left side, I started getting tensions, also having more and more tension in my left leg, basically.
All left-sided?
Yeah, I never really had pain on the right side.
Okay.
Can't really remember.
Let's rewind before 8 years ago, because I'm assuming you were active, played sports.
Yeah.
What did you play?
I did soccer as a child.
Okay. Football?
Or football, yeah.
Football. What position? Striker? Wing?
Like shooting goals is striker, probably.
Okay.
And like in the middle, like running a lot.
Okay, so you're pretty active.
Very active.
You got
yeah.
hit pretty good.
Yeah, I was decent.
Okay, cool.
Yeah, and then doing athletics, also in school, like running and sprinting.
Okay. Any injuries you remember?
Like nothing severe. No, not really. I don't know.
Okay. All right. So 8 years ago, mid-back starts to hurt. What do you do?
Well, I try like doing certain exercises, go to physiotherapists.
But see, here's the thing, all right? And, you hear these stories a lot. I mean, I hear a lot of stories. So when someone says, I'm just at an office job and all of a sudden my mid-back starts to hurt, it doesn't make sense.
Yeah.
So the question is it a lifestyle of something underlying that's going on and then the lifestyle triggered it?
Yeah.
That's one scenario. The second scenario is when someone tells me, I just went to pick up a pencil. And that wasn't the cause. We know that also. It was a trigger. That was an event of a process that was already going on. And that's what we want to discover today, okay?
Yeah.
Okay.
Yeah.
All right, so left hip, left knee.
Yeah.
Mid-back started.
Yeah.
Around between the shoulder blades or below the shoulder blades?
Below, like where it starts, pretty much.
Okay. And then did you see anybody for this? Have you had treatment? Have you
Yeah, like multiple things.
Out of everything you've done, any relief?
The thing that helped me the most is going to, in English, it's osteopath. Yeah, osteopath.
For what?
For healing, basically, or like helping me with the imbalance.
Adjustments or soft tissue work?
Soft tissue stuff.
Understood. Okay.
Which is mind blowing still to me.
Why?
He would touch my feet or work on my body, and like I would feel it like work in the back or actually at my pain point. So this gave me relief.
Okay.
But like never like fully sustainably long term.
Okay. And you've never had a full spine X-ray, right?
I think no.
Because you never saw what your whole spine looks like before. Okay.
I just know, or like I was told that I have a slight or like a scoliosis.
Curvature.
Curvature.
We'll determine if it is or it isn't. Okay.
Yeah.
All right. What else?
Well, you asked me like proper like injuries back then. I just remember like I had like a bike crash or something, but it was like nothing severe.
Okay.
Just regarding like where my body might have been hit in a way that something had an effect,
And his comment it's a typical comment. It's not a bad comment, not a good comment. And what happens is this, it's just like when people get rear-ended in a MVA, motor vehicle collision accident. You can be rear-ended at 5 miles an hour, not feel anything, and have damage a few days later, right? Similarly, especially as kids, I was a BMX freestyler, slip and fall in every single day. I mean, good. So as kids, we're playing, we're active, our adrenaline's going, you slip, you fall, you get right back up, your friends are around, you don't have time to be down.
Yeah.
And you get on with it.
Yeah.
9 times out of 10 guys, things resolve themselves. But it's when that one time that it stays out of alignment and the compensations then start. You don't have pain, but we have compensation.
Yeah.
And that's what we're going to show you today. Okay.
Yeah.
You ready to get started?
Yes.
All right. So anything in the feet, shoulders?
Like pain?
Any issues in the feet, shoulders?
Well, I have tension here.
Okay.
Not all the time, but I think it's a part of the compensation. And I have pain in the left wrist, but that is from like just typing way too much.
So we'll tune it all up.
Yeah.
You're writing code, huh? Okay. Come on over here, dude. Come on over here. Let's go over your x-rays. This is you. This is a picture in time. Tells us how you've evolved from birth. 24 bones in the spine that move, 23 discs in between. This is your 24-story building looking at you from the back. This is the foundation of your 24-story building. In order to have a stable building, we need a level base and foundation. And the first thing is, we might as well get right into it. Do we have a level base and foundation? Absolutely not. You've been following me for over a year?
Yeah.
Yeah, over a year, okay. And so I'm assuming, you know, we've been getting a lot of patients recently that don't watch the full long format, so they don't really get all the stuff. But it's nice when you guys actually watch it so we can get right into the work directly. And you've heard me talk about foundation then. Okay. So looking at you from the back side on the right on our foundation, we have a rotated sacrum, 14 millimeters on the left, drop down 3. We have a rotated pelvis on that same side, and we have a short or lower leg, 9 millimeters. Now, here's how we evaluate this. Let's demonstrate what's happening first at the left SI joint. So here's your sacrum, here's your pelvis. The sacrum goes back 14, that's pretty significant, and then drops 3. That 3 millimeter drop tells me there was an old tailbone injury. The left pelvis goes AS, anterior superior, internally rotated. So your pelvis actually goes up and in, your sacrum goes back and down. Then the whole thing goes down on that left. That's the disconnect. So think about it. This hip, the alignment of I'll use the baby spine. But if the femur sits in here and the alignment, let's say we're doing this side, has gone up and in, it changes the angle of the acetabulum. So that femur is never going to sit in its socket correctly. And so what happens? These ligaments, muscles, and labrum are all compensating.
Yeah.
And then also the knee.
Yeah.
Okay. Now, if I adjust your pelvis according to the numbers, I make you worse. So the answer is not getting your pelvis cracked.
Yeah.
Okay. The answer is in your tailbone. 9 MD. We don't want that. 3 of this is coming from the sacrum. We only have 4 days.
Gotta come again.
It's up to you to decide what you want to do. You're here till Saturday. But my focus with you is really going to be this tailbone down here. That's number 1. Does that make sense?
A lot, yeah.
Okay, let's follow it up. So from that short leg, you can see you have this curvature. The curvature you were not born with, you developed it from a short leg and a tailbone injury. Okay. Then what does it do? It comes back here to neutral, but it doesn't stop. It just keeps going into that S shape. So all of this that's going on up here is all compensation for your tailbone. Okay. When we get to here, I want you to see something. You have this kink here too. So look, this is your neck here. It goes to the right. Yes. There was some injury here. You got some lateral shift from here. Some blunt. It was a blunt hit, whether it was some injury or sport or something. So it created a slight side slip. T1, 2, 3, T4, around T4, T5, okay? This area here, so this is heart and lungs, this is digestion, okay? And we'll get to the digestion. You have a little bit of a right jaw deviation. If there's no pain, I don't mess with it. If it's bothering you, I'll work on it.
It isn't.
Then we're not messing with it.
Yeah.
Okay. 2 things we learned in the work. Never touch an asymptomatic knee or TMJ, no matter how bad it looks on the x-ray. That was one big lesson. So your case is foundation. Let's go to your side profile now and let's look at this. On this, what we're looking at posture. So the first thing we're going to do is let's run the posture line straight up. And the first thing we're going to see here, when we're looking at the side x-ray, we're looking at, do we have the right curvature? Posture-wise, we're looking at, does the hip, which we represent here at L5, match the neck or the shoulder here at the base and the ear? And what it's showing us is that you carry your upper body just slightly behind your foundation. So these muscles here are tight. At the end. I know they are. Even just sitting for an hour, you get tight and stiff. You a game or two?
Yeah, I mean, I sit a lot, actually.
Okay. You game too or no?
I don't.
No. Okay.
I used to a little bit, but...
Okay. So part of the answer to your neck is the posture. And you'll have basic stuff I'll give you to correct it. Okay?
Yeah.
Now, let's go a little deeper. And when we're looking at your sacrum, your tailbone, we want to see a nice smooth curve. I see it right there at S5 gone forward, say S5, coccyx, right there. You also had something at S3. So, whatever it was, I'm assuming it was just life. Your discs, I want you to notice something here, and it's part of our answer. When we look at this disc here, that's a level parallel disc. That's a good disc, okay? These are circular. You see that? Circles, 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 circles. It's because of the curve. So the disc is fine, but it looks different because it's tilting. But the disc is fine. 5, 4, 3, 2, 1. The other thing it tells us, all these tilts are because they're compensating for the foundation. Okay. These discs are fine. Discs good, good, good. Good, good, good. This one's a little less, but overall is fine. You have an almost textbook neck curve. So even with being behind, you have maintained your curve very well. So I'm happy with that. Curve is great. We just got to push it all forward now. Okay? Questions so far?
No, but since you asked me about injuries,
yes,
like I had a knee injury. Like
okay. Left knee?
Left knee.
What did you do?
I was playing soccer. That was 5 years ago approximately.
Okay.
I was playing soccer in the park.
All right.
Running, trying to catch the ball with the right leg. And then my left knee, or leg that was stabilizing, twisted. And then I got this typical soccer injury. It
twisted out like that or in like this? Do you remember?
That's a good question. I'm not sure right now.
We'll test it. We'll test it at the end.
But this typical soccer injury came here, and then I got a surgery like 5-6 weeks later.
Okay. Doing what? What was the surgery?
Well,
they cleaned it up?
No, fixing this thing, like, I don't know, cruciate ligament rupture, it's called, I think.
Cruciate.
Cruciate.
Anterior cruciate or post in the front?
It's the front one.
So your ACL was damaged.
ACL, yes, the ACL.
Okay.
And they fixed it.
Good.
Yeah.
But as I said, still off because of this.
Yeah, exactly.
So it'll be interesting for you to report back to me after we start the adjustments. We're not touching the knee today.
Yeah.
Okay, I'm very clear about that.
Yeah.
We're focusing on spine.
Yeah.
I'll work on your ankles if I need to. I'm happy to tune those up. We'll work on shoulders, elbows, wrists.
Yeah.
Okay? And one last thing I forgot. How's your breathing, your septum?
How my breathing is?
Yeah. Any issues in your breath?
I used to have, like, in winter always sinuses, like problems here, but I got it under control. Like, I'm totally fine.
You're fine with all that? Okay, so we're not messing with the nose either.
No.
Okay, you got it. You ready to get started?
Yes.
Let's rock and roll. Come on. And the first thing we're going to do is evaluate his posture and his walk. Let's tuck this in. Turn towards the corner of the room there, please. And all right, so let's take a look and see what do we got here. There's a little winging of the scapula there. You can see if you follow my finger. You look here, there's not a lot of swelling here. There's a tiny bit there. You can see the S-shaped curve going up. I do see a pocket of edema right here. As it goes up, I see a pocket of edema right here as well. Look straight ahead, please. And can you step forward? Step forward. March in place. March in place.
What's that?
The soldier.
Okay.
Hands on the side. Close your eyes. Keep marching. Stop. Open your eyes. So what I want you to see here is the right side is higher and the right ear looks bigger because it's gone back, almost like an ASRP atlas. Can I have you now walk to the corner of the room and back a few times so we can watch the gait? You guys walk really fast, dude.
Quiet, I can walk slower.
No, my wife said that in Germany, dude. Everyone walks really fast.
Yeah.
It's cold, that's why. keep walking. So here's what's interesting in his walk. I don't like his lumbar area. He's very unstable. Turn around. And I want you to watch this area here. You have that kink, but more importantly, I don't see a lot of stability here. Let's focus here when he walks. I'm talking to the viewers, by the way. And it just kind of goes side to side because of that instability. Just keep walking, please. Mid-back is more stiff. Walk on your toes. Your left leg, your left thigh, your left calf is a little bit smaller than your right.
Mm-hmm.
Your left side is a little bit smaller. And my suspicion is all coming from that left sacrum, dude. So we need to get that power on. Regular walking, please. Regular walking. Okay, and this is your normal walk, right? Cool. Have a seat. Let's get started. Starting at the base of the neck. Let's see what we got. And then from LA back to Germany?
Yeah.
Okay. Head down, please, starting at the base. First thing we're getting is C7, 5 points, left side. Right atlas, 10 points, right side. T67, left side. Is hot over there?
It can get really hot. Like sometimes we have 40 degrees Celsius. I don't know what that is
wow.
in Fahrenheit.
Yeah, that's hot.
But yeah, usually over 30. But we have one of the rainiest summers ever. It's actually pretty crazy.
L3 to the knee, the testy, and the ovary. 15 points, L3. S5, coccyx, L3, T7, C6, C7, C1, okay? Now, let's go ahead and do static palpation, running my fingers down the spine, head down, please. And what we're looking at in static palpation, starting here, is that swelling and edema. Hold your head. See, right here is okay, starts there. That's edema. That's swelling and information. Dr. Gonstead used to say, show the other man what you see. I'm trying to show you guys. These are the instrument breaks. This is static palpation showing inflammation and edema. Point tenderness. It's going to be tender when I push there, yes?
Mm-hmm.
And there. More here though.
Yeah.
Yes?
Mm-hmm.
2, 3, 4, 5, 6. And you know what I love about this work is that, you know, it's really cool when you get your break, all your findings are there, everything points to that spot, and you've got so much certainty that that's the one that's going to help the patient. Doesn't mean they're going to feel good, but they're going to get help. 5, 4, 3. Tender. Come back slowly towards me. That's 3. That's 2. Now, I want you guys to see this. Look at his back. This is not how he should be sitting. He should be sitting like that. But that's not comfortable right now, is it?
No.
And that's what I'm hoping I can make this more comfortable. Is that tender here? Tender?
Mm-hmm.
Or this one?
That's close.
Same?
Yeah, kind of. Oh, okay.
Right there.
Yeah. This one.
5, 4, 3. L3. One, 2, 3. 3 is tender too. 4. 4 more tender? Or 3?
No, 3. Definitely 3.
How about down low at 5?
No, that's chill.
S3, L3. T6, 3, 3, 6. Sit back for me, please. Let me do the work. I got to grab a little bit of your hair, okay?
Mm-hmm.
That's 6. That's 7, 6. ASRP. Okay. So, here's our game plan for today. S3, L3, T6, C6, C1. Now, there's 2 in the neck, so we have to determine which one. We're going to do a quick test called Divore's test. And we're going to isolate upper and lower cervical spine. Look up, that's lower cervical spine. Turn left, turn right. Now we're going to go down into flexion, upper cervical, left, right. Which one feels worse to you? Down and left or back and left? Right is fine. Down and left feels tight to me there.
Down and left, I think.
Okay, so that's going to be the atlas.
Yeah.
ASRP on the right. Hold your head. That means, let me just check on his C2. Yeah, we'll do C2 on the left, ASRP on the right. PRS, I can justify. PRS. And he has a special listing, PRS-M at L3. Okay. You ready?
Yep.
Showtime. Sit up straight, please. Center on the chair. Scoot to the left a little bit. Scoot to the right a little bit. There you go. Let's go ahead and sit back for me. C2. You crack your neck a lot, and I can feel it.
Yeah.
Yeah. C2, tight. There it is. Lift that nose. Perfect. Like butter. C1, right side. Now for his C1, we got to come over that C2. Clunk. Perfect. Walk it off once, please. Vergnügen.
It feels good.
A little different, yeah? Okay, let's do S3, right side down. Bear with me, okay? Keep that straight.
Yep.
Tuck this forward. I got you the whole way. I got to be down a little bit low there, okay?
Yeah.
2, 3. Now, for his S3, we want to torque it up. Let it roll. Let it roll. I want you to hook your ankle there. Let that bottom leg straighten out. No. No. Hook, straight. So in your case, in order for me to keep his back straight, that leg needs to come out a little bit, so I'm all right with it. Got it? And torque up. Wow, gotcha. Come on up. Face down over here, sir. Step on the black platform. More of S3. Face down, enjoy the ride. Perfect. Torque. Wow. Gotcha. How do you say home run in German? Yeah, I know you have baseball in Germany. the clunk.
That was good.
Head down, chin down. A little more. Clunk. That was nice.
Yes.
Slow your roll, brother.
Yeah, I gotta walk slower.
All right, let me just fix this. Walk it out. What's different after that?
I don't know. I feel lightweight right now.
Okay.
No, I don't know. It's more smooth.
Okay.
I feel like I'm less blocked in a way.
Let me open the back and let's see what's different. I still have third lumbar. Tell me how the hip and knee are too. Because that's what you came for.
I don't know. It feels more smooth.
Walk.
It feels less like it's blocked. You know.
You feel more planted
Yeah.
on the ground. You
Yeah.
feel your feet better.
Yeah, definitely.
Now, you came all this way.
What do we do?
You've seen this table, right?
Hmm?
You've seen this table?
Yes.
Your turn. You're going to go down on your knees, please. Knees forward a little bit. Tummy down all the way. There you go. Good. 5, 4, 3. Chin up a little bit. Booyah. Gotcha. That's the home run, baby.
Oy.
That was Fafignugan. Come on up. Walk it out. Good stuff.
Ooh, that was wild.
Walk it off. L3 goes to the knee, the testy in males, the ovary in females. L3 goes to the hip flexor. These muscles. Keep walking. Walk on your toes, please. Should be a little easier. Walk on your heels, please. Should be a little smoother. Pretty cool.
Yeah, it's easy.
One more time, regular walking.
On the heels?
Regular walking.
Regular.
Yo. Have a seat, sir. Starting at the base, neck is clear. Neck is clear. Nice. So we made the right call there. Mid back is clear. L3 is clear. How do you say home run in German, dude? How do you say clear?
Klar.
Klar?
Yeah.
Klar?
Yeah.
Like zero? Clear?
But you would say sauber.
Sauber?
Yeah.
Sauber
Sauber.
means
Like clean.
clean, okay.
Yeah.
Sauber.
Yeah.
Tell me home run next time, okay?
Yeah, I need to.
How do you not know home run, dude? Oh, sit up straight. Let's check. Do you remember what the tailbone felt like before?
Yes, I remember.
Come back.
exactly.
5. This is 5. This is 1.
Yeah.
This is 2. This is 3, dude. Different?
Yeah.
4. This is 3. Pretty cool, huh?
Yeah.
Awesome. Now, shoulders and ears. Shoulder, drop. On your back, please. Want to work on your ankles. I don't think we need to touch your knee, dude.
That would be.
I don't
phenomenal.
think. I don't think it's your knee.
Yeah.
Slide up.
But I also always had the feeling the attention is coming from here, you know, and going there.
Yes. S3.
Yeah.
Now the buff and polish. This is vibration therapy, David, the magic frequency is around 10,000 RPMs, okay, or 170 hertz. When it goes over normal tissue, it does absolutely nothing. It just feels like a buzz. When it goes over the scar tissue, you feel that little tickly spice. That's the scar tissue. Your homework while you're here with me, or while you're visiting, you know, for your adjustments, just walking and hiking.
Okay.
Enjoy LA.
Yeah.
Get to the beach, get on the sand, get in the water.
No workout.
If
Like-
you don't need to work out while you're
Yeah.
here, do you? Just go to
Yeah.
the beach and hang out, man.
Yeah.
Enjoy your time. Squeeze the hand. Turn and face me, please. Squeeze. Squeeze. Relax. Elbow. Ulna. Lunate.
Oh, that felt good.
Ulna. Lunate. Scaphoid. A little more. There. Thumb. Squeeze. Squeeze. Questions for today?
Not really. I like that one. Like, you know.
L3.
Yeah, like it released, like, I don't know, my breathing feels better.
Good.
I feel more free. I don't know. It's really good.
Good. Awesome.
Thanks.
Welcome to the office.
Thanks.
You got it.